Hello, everyone. Hello, who is this? I'm sorry, I didn't really see you.
Here is Peterson.
Peterson. Okay, great. Hello, dear. Okay,
Hello,
Kundan
ma'am.
has a question. What's your question, my dear?
Ma'am, I just wanted to ask that
Mhm.
just in case there is a note made by a client and it has some, let's say, some word which I know the meaning of, but the patient is unable to understand, right? So the patient asks me in return, what am I supposed to do? I'm a bit confused. Should I inform the client and then reply on my own, or what should be the protocol, ma'am? That's what my confusion is.
Okay, so you're saying that maybe the client is saying something, and when you did the translation to the LEP doesn't understand this, so the LEP asks you, what is that, or what does that mean? So you're
Yes,
asking, what is the protocol in this case? Can
yes.
anyone
It can be any
actually
name of a
answer,
disease
Kundan?
or I'm sorry.
Okay, let me ask the others because this is already included in the protocol, and I already mentioned this when I was explaining about the protocol. I guess, Kundan, you were there, right? You attended this session.
Yes, ma'am. I'm just a bit confused about the about my end, what I'm supposed to do on my end.
Okay. So can anyone actually answer, Kundan?
Can I, Johnson?
Sure, please go ahead.
Okay, thank you. So what I will do is if a LEP said something and then the client interpreted to the client and the client said, what does it mean? I didn't understand. I will just go back to the LEP and say the same thing and wait for the LEP to explain.
Uh, well, it was the other way around. His question was that the client said something. Maybe the client gave a name of a disease that the interpreter interpreted the name of the disease, interpreted it to the LEP, but the LEP doesn't understand. So the LEP asks the interpreter, "What does this mean?" In this case, how would the interpreter react? What should they do in this case if the LAP is interacting with the interpreter directly, like asking the interpreter to clarify or
And
to
this,
explain?
yeah,
Okay,
this is,
again, I will.
Mhm.
yeah, in this case, you have to keep the provider in the loop, as you said.
Exactly. So what you're going to do?
You have to interpret everything the LEP has said back to the provider.
Exactly. So in this case, if you remember, Kundan, when we talked about the protocol in the first session, there is it is in the part of controlling the flow of the conversation
Yes, ma'am. Right.
that interpreter cannot explain. Interpreter's job is to only interpret, and you cannot explain. In this case, what you should do if you were asked by either party to explain what does this mean or that mean, or what does or what that person means by saying this or that. In this case, if it's the patient who's asking me or the LAP who's asking me, I should go to the client immediately and say, "Excuse me, this is the interpreter speaking. The patient just asked for explanation, so can you please further explain for the patient?" This is what you should do. If it's
So,
a name of a disease that the patient doesn't know what is that, and you did your part, you said the correct equivalent for that disease, okay, but still the patient doesn't understand, so you should go to the client in this case and say, "Excuse me, this is the interpreter. The patient just addressed the interpreter asking for further explanation, so can you please explain further for the patient or to the patient?" That's it. In this case, or that way, if you do that, you are telling the client first that I am transparent, I am translating everything that's happening in this conversation. This is number one. So I am transparent, and I am a professional interpreter. I'm doing my job. And number two, I'm not overstepping your position. I'm not overstepping you, doctor, because this should be you who's explaining things to patient, because this is not my conversation. This is a conversation between you and your patient. I'm not part of it. Okay. Any other questions, guys?
thank you. Thank you.
Thank you, Kundan. Does anyone else have any other question before we start? I don't know why Skype on my desktop is not working. Anyways, I don't think I might need it since I can actually do it on my phone. But I just want to like get you all guys. I just want to have a view of all the attendees, and I don't know how to do it on my phone, to be honest with you. And I also want to like call the others who hasn't, the others who haven't actually attended until now, and unfortunately, it's not an option on the application. Together mode. Nope. Large gallery. Nope. It's not gonna work. Speaker view. It's not gonna be. For the speaker. Okay. So I'm gonna say your names. Let me try one more time. I'm sorry with the desktop last time. Just to just make sure that I did everything on my end. Until Skype works on my PC, I am going to ask you. I'm gonna take your names, guys. Okay. So I have Behnaz, right?
Yeah.
And I have Jonesy, Noodly, Gessner, Kundan.
Yes, ma'am, I'm here.
Thank you. And I have Dash.
Dudley is here.
Okay. I have Stevens, right? Stevens, that's you?
Yeah, I'm
Great.
here.
And I have Junior Rama. Peterson. You're still here, right?
Yes, ma'am.
Peterson, okay. Peterson. Javier. FD. Who's the FD? We have friends. Okay, friends. That's
I'm here.
friends. Great. And did I miss anyone? Okay. Guys, can anyone just open the participants? Like go to the settings of this group, go to participants and call all the others who haven't attended yet. Like ring them. Jonesy, can you please do that? Ring the others on the group.
Okay.
And tell me if you did.
Okay.
Diego, I have Arwa, Diego, Pragna,
Yeah.
who else? Noah, Rolf, and I guess that
Is Judy? Judy.
and Judy. Yes, please, and Judy.
What about Lee? Lee
Yeah,
Tang?
just call them all. Call all the others.
Oh, okay. Sorry.
Ring
Okay,
them
sorry.
all, and whoever attends, yeah.
Abdul Muaz. Abdul Muaz.
Okay,
Arwa.
yeah, just all of them.
Yeah.
I did
Behnaz.
call all of them. I did call all of them.
Thank you. Okay, thank you. Thank you. Just one person, guys, because we don't want to just annoy them. And let me try to see if I can open the chat. Yes, I do. Okay. Pragna. Okay, Pragna, will you be able to attend today's session? Oh, okay. Pragna, you did inform Zainab already that you're sick today, right?
Okay.
Very well. If you cannot attend today's session because you are sick, please just send to Zainab, tell her, and you can just have the day off today since you cannot actually speak.
Okay. Actually, yeah. Sorry, my voice.
Sure, no problem, my dear. And make sure that you also like watch the recording. We're still recording today's session.
Yeah.
Okay,
Sorry,
great.
I can't speak
Thank you.
much. Yeah.
No problem.
you.
Thank you, dear. See you next time. Who else we have here? Okay, so let's start today's session. And since I cannot really see you all, I'm going to just say your names. And please, if you are here, make sure that you unmute yourself as fast as you can, please. So I'm going to start with the medical terms first. Okay. Hold on a moment. Where is the sheet? I gave you until the first, how many? Until heat stroke, right? Or measles? Pacemaker? Who can tell me? Until heat stroke, right? Until 45. Let me go back to the chat and see. Open chat. Okay, yeah, okay. Heat stroke. Okay, amazing. So, Behnaz,
Yeah, ma.
please tell me what is embolism?
What is embolism?
Yep.
Okay, ma. Refers yeah, embolism was a blockage of the arteries by a blood clot. Am I right?
Yep, thank you. Okay, June say, what is a sprain? What does that mean? A sprain?
Actually, that was from the previous
Did
one,
you say
ma.
spleen?
Yeah, that's from the previous. I just added more to them, which is fine. Like if I ask about what we had before or what we had yesterday. So thank you,
Gotcha.
Behnaz. June say, what is a sprain?
Is it dislocation of tendon?
Dislocation? No, it's not dislocation. A sprain. Someone is having a sprain. With
When the muscle or the tendon has moved from its normal position?
a twisted tendons, twisted whatever joints maybe. So it's not a dislocation. It is a twist. Hold on, I'm sorry, my computer is not working again. Wait.
Spleen like spleen, right?
Sprain. S-P-R-A-I-N.
Oh, okay.
A
Right,
sprain.
right.
Twisted ligaments. Okay, thank you.
Okay.
Thank you, Junse. Noodly, please tell me what is a bloody stool? What does that mean? A bloody stool? Noodly
Talk about the blood.
is what, I'm sorry?
Blood stool.
Yep,
Bloody
bloody stool. Mhm.
Blood stool. It's a bloody stool. Blood is stool.
What is a stool? What does that mean? A stool?
The blood stool. When we talk about the stool.
Noodly, did you study medical
Yeah, I'm
terms and
sorry.
acronyms? Okay.
You asked me the meaning the stool.
Yeah, what is a bloody stool? What does that mean? And what is a stool actually? So bloody is bloody. What is a stool?
Stool. STOOL.
Exactly, yes.
It's especially for one person, without an armrest.
Is what again? I'm sorry. I just heard from one person.
Okay. A seat for one person without a back or armrest. That correct?
Unrest? No. Stool is the medical name for feces.
Officers?
Yeah. That's the medical name for feces. And a
Okay.
bloody stool means that someone is having
Can I?
blood in their stool, in their feces.
Yeah.
Well, it's true.
Yep. Noodly, please study well, please, as much as you can. Give it more time.
Okay.
Gessner, what
Yeah.
is postpartum depression?
Mute me again.
Noodly, no, please mute yourself. Thank you so much. This is for
Okay.
Gessner.
Okay.
Gessner, what is postpartum depression?
Okay, postpartum depression, it's a depression that occurs after childbirth.
Thank you so
Those
much.
who develop, yep,
Yep, that's it. Thank you.
yeah.
It could happen after or when it happens. Okay, anyway, you said it correct. Thank you. Kundan, please tell me what is a pacemaker?
Ma'am, a pacemaker is a small device which is installed in the heart in order to control the heartbeat in case of any kind of abnormal heartbeat.
Great, amazing. Thank you so much. Dash,
Yes,
uh,
ma'am.
what is gout?
What is
Gout.
gout? All right.
Yep.
Gout is a type of inflammatory arthritis. Like it causes some kind of pain in the joints and also, of course, swelling.
Okay, there are two things that are very special about gout that makes it actually special from any normal arthritis. What are
Yeah.
those two things?
So gout starts in the it starts in the row like in the toes like going up, I think.
Okay, in the toes. Typically, it happens
Yeah,
in the
in the
toe.
toes.
Okay, and what else? How it happens actually, and why? Why would that happen to someone?
Yeah.
Because of
Mm,
what?
uh,
High levels of
high level of uric acid.
uric acid. Great,
Yeah,
thank you
yeah,
so
yeah.
much. Amazing. Stevens, please tell me what does an overdose mean? Stevens, can't hear you. Stevens, can you hear me? Problem is that I really cannot see you guys. I don't know what's happening with you. If you are muted or if you're trying to speak. So just try to help me, please. Um, Stevens. Stevens. Okay. Let's leave Stevens until the end. Rima. Rima, can you hear me?
Ma'am,
Oh,
can you
great.
hear me?
Yep. Rima,
Okay.
please tell me what is.
Stephen.
Oh, that's Stevens? Really? Okay.
Yeah, Stevens.
Thank you. So, Stevens, I just asked you a question that I really forgot. What is numbness?
Overdose.
Okay, I need numbness now.
Numbness.
Yeah, what does that mean?
Okay.
Hmm.
Can you numbness? It is loss of sensation.
Great, thank you. Rayma, thank you
You're
so much.
welcome.
Rayma, what is Rayma? Can you hear me? I'm not gonna say the term before you actually unmute yourself. Rayma, Rayma's not here. Peterson,
Yes, ma'am. Can you hear me?
yep. What is irritable bowel syndrome?
I'm sorry, what did you say, ma'am?
Irritable bowel syndrome.
Irritable bowel syndrome?
Yep.
I don't think that I've studied that. Um, was it from the last um, terminologies that you gave us
Yep.
yesterday?
Yep. Of course. Number 26.
No, I don't think that I studied that. Can you
Okay.
please ask
Uh,
another one? I'm sorry.
okay, sure. What is congenital abnormalities?
Congenital of
Congenital abnormalities.
congenital abnormalities.
Mm-hmm.
I'm sorry, I missed that.
Peterson, did you study?
Yes, ma'am.
Okay.
I studied like hormone replacement, measles,
Mm-hmm.
gout,
Just the ones that I
fish.
sent yesterday? What about the
Yes,
others that I sent the day before? Did you forget those?
yes, I forget about them because I didn't.
No, of course you shouldn't. Come on.
I'm
Oh
sorry,
my God.
man.
Does this mean that as soon as you start working as an interpreter, you will forget everything
No,
about
man.
the training?
I think that right up right before I started working about like as an interpreter, I would study them more. But you know,
Okay. Makes
yesterday I was
sense.
focused. Yesterday I was focused on
Okay.
the
Okay,
no.
I'm gonna ask you about what I sent yesterday. Okay. But make sure that you review the
Okay.
old things
Yeah.
that we talked about because yeah, we can easily forget. Okay,
Okay.
tell me please, what is vaginal yeast infection?
Vaginal yeast infection. It's a kind of infection that causes irritation and intense itchiness of the vagina.
Thank you, but it happens because of what?
Um,
I
can you
mean, what
please give me
causes this infection? Well,
what
again,
causes
vaginal yeast infection causes because of where it happens because excessive growth of.
yes, I remember it was causes because of
Uh-huh.
irritation. No, it was it's a kind of
Ye-
like infection,
Infection of what?
fungal.
Fungal. Exactly.
Yeah.
It's a fungal infection. Thank you.
Yes. Thank you, ma'am.
Okay. Rima again. Can you hear me now? Rima? Sorry guys, I can only listen. Why? If you have a problem, please work on resolving it very quickly. Because what we're going to do today is exactly what we did yesterday. We're going to practice, and you have to practice. I have to hear you. You can't be a listener only today. I'm not gonna explain anything today. I'm not gonna explain anything new. Okay, so uh, Javier, did you study? I bet you did. You have to. So Javier, can you hear me?
Yes, man, kind of.
Amazing. So what is blood clot? What is a blood clot? Javier?
Come again? I believe.
Blood clot. Blood clot. Okay, what is bone marrow? Javier left. Thank you. Javier. Well, I have Rolf attended Rolf here, and who else is here? Yeah, just Rolf. Okay, Javier. Oh, and Diego. Amazing. Javier, my dear. Okay, friends. Friends, please tell me. Friends is here, right? Oh. Friends, can you hear me? Friends.
Hello, can you hear you?
Yes, I can hear you. Okay,
Hi.
so friends, please tell me uh what is What is a septic shock?
A what?
Septic shock.
Septic.
Mhm.
Um, I think like I'm gonna kind of, you know, I think it's a
Mhm.
widespread infection.
It, oh, it is an infection. Well, it happens because of an infection.
Yeah, so it's an organ failure and
Organ
like low
failure.
blood pressure.
Yeah, okay. Low blood pressure, okay, might happen because of a dangerous infection.
Yeah,
Okay. And uh okay.
yeah, it's like it's like organ failure and dangerously low blood pressure.
Okay. And it also happens because of a sepsis. If you know what
Okay.
sepsis is,
Yeah, I know.
you know? So what is sepsis?
Sepsis. So I
Yep.
think these are I don't know how to explain it, but um 1 second. I think
Mhm.
um okay. So let me just kind of you
Mhm.
know
Okay.
uh try to formulate it
Try as
and
much as you can. Take your time.
so it's a bacterial expression like it's a bacterial infections and um so it's
It's a
lung
life-threatening
disease.
infection.
Yeah,
Lung disease? No, I don't think it's related to lung. It is a life-threatening kind of infection, and it's a medical emergency. It happens like it happens because of a severe infection. The blood is um, uh, uh, has what has phased or not phased. Um, Let me try to. I also want to like choose the words that will be straight to the point. Uh, when the body is has caught any infection and this infection is a life-threatening infection, it causes sepsis. Okay, sepsis is kind of well, I really know it in Arabic, but I'm not very sure about it in English. Okay, so again, a life-threatening infection that causes the body to, you know, it causes, yes, it actually causes um, organ failures, unfortunately. Um, called, okay, okay, well, exactly as you said, I think. A life-threatening reaction to an infection. A very bad infection that causes that actually gets to the body somehow, that causes dysfunction, yes, organ dysfunction, and causes a lot of complications. A septic shock is when the blood pressure drops, when the blood levels drop to a life-threatening level, and we call it a septic shock. Thank you. Who else? That was friends. Thank you. I have Rolf and Diego. Rolf, please tell me what is an overdose? What is an overdose? Rolf? Rolf? Diego, can you hear me?
Yes. Yes, hi. I am here.
Hello, my dear. Okay, so
Good afternoon.
what is breast self-exam?
What is what? Sorry?
Breast self-exam.
Ah, yes. That is a step-by-step method that women can follow. Sorry, my throat is a bit sore. To check, to examine their breasts.
Okay, thank you. And I have Rolf. Rolf, can you hear me? Rolf, can you hear me? Okay, Rolf and Rima. Rima, I think we can hear you now, right? Just unmute yourself. Rima. Remove Rolf and Rima and cool them. Oh, now my Skype is working on the display. You guys. Beauty, Rolf, Rima. Okay, until then, I'm going to ask you guys about the acronyms. Acronyms are easier, so I just want you to please be fast in replying. And let me check. Rolf, can you hear me? I guess you can now. You can speak, right?
Yeah, can you hear me?
Yep, except that your voice is kind of far away. So, Rolf, please tell me, what is a kidney failure? Rolf? Guys, do you mute yourselves because you don't want to speak? You are unmuted just a moment ago and I heard you.
Yes, can you hear me?
Yep. What is a kidney failure?
Kidney failure is when the kidney no longer work properly.
When the kidney normally does what?
When the kidney no longer work properly.
When the kidney doesn't work properly?
No longer.
No longer work properly. Okay. Thank you. When the kidney is not functioning anymore because bloodstream is not going there. Thank you.
You're welcome.
Rima, can you please unmute yourself? Rima? Okay. So I'm gonna ask you guys about the acronyms. I did give you yesterday until check again number until the 25th. So where are they? Behnaz, please tell me, what is BCV? I'm sorry, CBC. What is CBC?
What is what, ma'am?
CBC.
CVN?
N? It's CBC.
Yeah, CBC. It means complete blood count.
Thank you.
I've heard C.
That's totally fine, no problem. June say, what is GI?
Gastroenteritis.
Hold on, I'm sorry. I think the numbers that I have here are kind of different from the ones that I used to send you. Sorry.
You said GI, right?
Yeah, I guess that wasn't included. Oh, it is included already. Okay, very well. Okay, yeah,
Did
GI.
I? Yeah,
What
I
did you
said
say?
gastroenteritis.
Intestinal.
Gastroenteritis.
Intestinal. Gastrointestinal. Thank you so much. Noodly, what is ICU? Noodly. Noodly, can you hear me?
RC, RCU,
ICU.
ICU or RCU? ICU,
ICU.
ICU. ICU is the intensive care unit.
Intensive care unit. Thank you. Gessner, what is COPD? Gessner,
Yes,
what
ma'am.
is COPD?
It's chronic obstructive pulmonary disease.
Thank you so much. Kundan, what is DNR?
Do not resuscitate.
Thank you. Dash, what is DNC?
D
D and C.
DNC. Okay, it's the dilatation and curettage.
Dilation and curettage.
Dilation and curettage.
Thank
Yeah.
you. Stevens. Stevens, what is
Yeah, ma'am.
ENT?
Yeah, I'm here. ENT.
Yep.
Ear, nose, and throat.
Thank you. Peterson,
Welcome.
what is EMS?
Hey, ma'am, can you hear me?
Yep. EMS.
EMS is emergency medical service.
Thank you. Javier. Javier, what is that? Please mute yourself. Javier. Okay. What is G tube?
Is a gastric tube.
Thank you. Friends, what is HIV? Friends, quickly, my dear. Friends,
HIV is human immunodeficiency virus.
thank you. What is CPR again?
CPR is cardiopulmonary resuscitation.
Thank you so much. Rolf, do we still have you?
Yes, can you hear me, ma'am?
Yeah. What is ADHD? ADHD.
AD?
ADHD.
AHDHD, is that correct?
ADHD.
Okay.
Can you hear me?
Who's this? Friends?
I'm France. Yeah.
We're asking Rolf now. So
Oh, okay.
thank
All
you.
right.
Rolf? Rolf, please tell me what is DNA? Or you know what is DPT? Rolf, what is DPT?
I said DPT, is that correct?
Yep.
This is doctor of physical therapy.
Nope. Rolf, please study. Diego.
Can I
Diego,
answer
please tell
this?
me who's this?
Yes, ma'am.
DPT.
I'm
Can I
here.
answer this?
No, dear. Thank you so much. Diego, what is AIDS?
AIDS stands for acquired immune deficiency syndrome.
Thank you so much. Okay. Guys, please be ready with a pen and a paper. We're going to continue practicing. I will just give you 2 minutes. Okay? Now it's 43. At 45 sharp, I'll be giving you sentences. So I hope that you guys, none of you actually says that I wasn't ready. Please be ready in 2 minutes. Okay. I gave you 1 more minute, so I'm gonna start. How many sexual partners have you had? The symptoms that you are describing might be HIV. You have fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes for a long period of time. Dash?
Sorry, ma'am. I had the connection problem. I quite didn't get it.
Okay. Stevens. Stevens?
Ma'am,
Yep.
can you give me 1 moment, please?
What?
Can you give me 1 moment?
Yeah, for what?
Just to fix. Okay.
Why? Are you going
To
to
arrange
school?
my phrase, to arrange my notes.
Oh, you're taking longer. than what you should take to start your rendition. If you remember, when we talked about that, we said that you only have 3 seconds to start the rendition after the speaker stopped speaking.
Okay.
So please go ahead with the sentence. Stevens, please go ahead with the sentence.
What I just noted, because the sentence is okay. I'm going to read what I've just noted.
Please.
Okay. How many sexual partners do you have? The symptoms you have described to me is you have fever, as you have fever, muscle strain, and yeah, it's all I've noted.
Okay.
Okay.
Peterson,
Yes, ma'am.
please go ahead.
Okay, first of all, I had some connections problem. I don't know what happened. Okay, I noted that you said, how many sexual partners have you had? And the sentence you're describing might be HIV, you have fever, chills, rash night, and swollen lymph for a long period of time.
What is rash night? What does that mean?
I didn't really get the phrase when you said it. I'm sorry.
Okay, but
I,
you
I wasn't
said
ready at all.
rash. I understand. Guys, again, you shouldn't just give any sentence. You have to give a sentence that makes sense. Something
Yes,
that has a meaning. So what does a rash night means?
I'm
What
sorry,
does that
ma'am.
mean?
I wasn't ready at all. I think that I will do better
Okay.
with the second
Okay.
sentence.
Okay. Okay.
Yes,
Okay.
yes, ma'am.
Javier, please go ahead.
Okay, what I heard was, how many sexual partners do you have? The sentence you described likely to be HIV. Are you suffering from fever, fatigue for a long period of time?
You have a lot of omissions, but thank you for trying your best. Friends? Friends?
Yeah, hello.
Yep, please go ahead.
Um, I think I missed most of the sentence, most part of the sentence because I went to
Yeah, just
drink some water,
no problem. Just
and when
do
I
your
came
best.
back,
Try.
I don't know. I think it's how many sexual partners do you have you had? And the symptoms that you're describing to me are HIV, and that's all I got.
Okay. Rolf?
Hello, can you hear me?
Yep, I can. Please go ahead.
Yes. To be honest, I was away from my desktop, like by the time you're
Okay.
reading the sentence, and I was drinking some water. By the time I get back,
Mhm.
I didn't listen to. I didn't hear exactly the sentence.
Okay. Diego, please go ahead.
All right. So how many sexual partners have you had? Because the symptoms you are describing to me appear to be HIV. You have had numb limbs, fatigue, a sore throat, a fever, muscle strain, and chills for a long period of time.
What are the symptoms again? You said numb limbs?
Yes, numb limbs, fatigue, a sore throat, fever, muscle strain, and chills.
Muscle strains, fatigue, sore throat, fever, and chills. So you have 1, 2, 3. Okay, so you have 2 omissions and 1 misinterpretation. Thank you for trying your best. Yeah, yeah. 2 omissions and One misinterpretation. I'll let you know
What
in
is
the end.
the misinterpretation, please?
I'll let you know, but in the end, I just need to hear the others because if I give you the answer now, they would like to. They're going to
Okay.
cheat. So we don't want to do that. Okay.
Okay.
Kundan, please go ahead.
What I got is how many sexual partners have you had? The symptoms you're describing seem to be like HIV. Are you suffering from fever, muscle strain, chills, sore throat, and fatigue?
Still the same problem. You have omissions and one misinterpretation.
Okay.
Gessner.
I will wait for the answer. I missed some parts.
You didn't get the sentence. Okay. Nudli. Nudli, please go ahead.
Excuse me, I was prevented. I haven't been here you.
Guys, I told you already that I'm going to give the sentence sharp at 45, and I actually gave you the sentence at 46. Okay,
Okay.
no problem.
Okay.
Thank you. Jumse, please go ahead.
Okay, thank you. How many sexual partners have you had? The symptom you are showing might be HIV. You have fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and a swollen lymph node for a long period of time.
Amazing. Thank you so much. Mihnaz?
Come on. How many sexual partners have you had? The symptoms you have told me might be HIV. You have fever, chills, rash, night sweat, sore throat, muscle aches, fatigue, swallow lymph node for a long period of time.
Amazing. Thank you so much. So that was, again, Diego, the mistakes that you've made. The sentence was, how many sexual partners have you had? Those who said, do you have? Again, this is incorrect. You made a mistake. With the tense, so you changed the meaning. The tense here is in the past, so you should also use a past tense. If you use the present, you changed the meaning, you made a mistake. This is number one. Number two, the symptoms you are describing might be HIV. I remember that I actually used this example when I was explaining about the protocol, and I can't really remember who said that this is a good example for you to understand. I guess that should have already rang a bell. As soon as I say the sentence, you should remember that that was the example that I was explaining and asking you to please make sure that you don't commit those mistakes. Again, the sentence that you are describing might be. It doesn't appear to be. It might be. I don't know. I'm not sure. It's not definite. I'm not quite sure about it. Okay, so this might be HIV. You have fever, chills, rash, night sweats, muscle aches, sore throat, fatigue, and swollen lymph nodes. Not limbs, swollen lymph nodes for a long period of time. Your lymph nodes, guys, this is like a part of your body, an organ. Okay? Lymph nodes. You have it in your legs. Exactly. Thank you, Diego. This is exactly what I was explaining, that if you change the tense from the past to present, it is it would be insulting. It won't sound like it's the best thing to say in this situation, because especially with sexually transmitted diseases, we do much care about what words we're using, because this is a very sensitive topic. So please make sure, again, that when you're having a call about any sensitive topic, that you are choosing your words very carefully, and the way that you say it, the tenses. If the person is trying, if the speaker, the client is trying to be sensitive and selecting the words, please do that as the interpreter, because you are conveying the same message. You shouldn't change the meaning or the message or anything of the original utterance, please. So that was the first sentence. Second sentence, guys, please pay attention. Those who do not pay attention, I am going to send feedbacks about you, okay? So please pay attention, take it seriously. We're not wasting our times here. We are actually practicing, we're preparing ourselves for this job. And it's not just a job that you can do, it is a very important one. It is a crucial one, as you see in the previous, as you saw actually in the previous sentence. Next sentence. I am concerned you might have developed asthma. You have wheezing, coughing, and chest tightness becoming severe and constant, with episodes of being too breathless to eat, speak, or sleep. I'm trying to slow down for you guys, okay? But this is not the normal pace a speaker could actually use to give sentences in a normal conversation. Okay. Well, please start. Well, friends, please go ahead. Friends. Javier, please go ahead.
Right, what I heard was you are concerned to be developed in asthma. Then I couldn't heard clear about the second sentence, and the last sentence will be you are constant to have problem with eat, speak, or sleep. Yeah, that is what I heard. Yeah.
Thank you for trying your best. Peterson. Peterson?
Hey, ma'am, can you hear me?
Please go ahead. Sorry, one moment. Go ahead, Peterson, please.
Hey, ma'am, can you hear me?
Yes, I do.
Okay, you said I'm concerned. I'm sorry. I'm concerned you might have developed asthma. You have wheezing, coughing, and chest tightness becoming severe and constant with episode. I'm sorry, I missed the last part.
Okay, no problem. But thank you so much for actually getting this part of the sentence. And I'm gonna ask you in the end what it means because let's see.
Okay. Okay.
Stevens, go ahead. Stevens.
Okay. Okay. Can you hear me?
Yes, I can. Please go ahead.
I'm concerned that you have asthma because you have wheezing, coughing before coming severe. That's all I've noted.
Okay.
Thank
Nudely. Nudely. Noodly, we can't hear you. Gessner, please go ahead.
I'm concerned you might have asthma and chest tightness because of severe and consist of being too breathless to eat or sleep.
Because severe and consistent or constant what?
I missed that one.
Okay. No, friends. Unfortunately, we can't hear you. Dash, please go ahead.
Okay, I'm concerned that you might have asthma, cause you are wheezing, coughing, chest tightness, which is being severe and constant, and you are being too breathless to sleep or eat.
Thank you for trying your best. You have some omissions, but thank you.
Right.
Kundan.
I'm concerned you might have asthma. You have a wheezing, coughing, chest tightness, which is increasingly constant, and breathlessness. I'm sorry, I missed it.
Kundan, I'm sorry, you're breaking up. Can you please repeat the sentence?
Sorry. Am I audible now?
Yeah, you are. Please go ahead.
I'm concerned that you might have asthma. Uh, mm, you have wheezing, coughing, and that's it, ma'am.
You said something in the end. I just heard you.
Yeah. Uh, it's I said chest tightness, which is increasing.
Uh-huh. Increasing. Okay. That's it?
Yes, ma'am.
Okay. Uh, who else? Jonesy. Hold on, I'm sorry, Jonesy. Wait. Diego first.
Okay, I am concerned you may have developed asthma because you have wheezing, coughing, and chest pain, which is becoming severe, and you have had episodes of issues speaking and sleeping, and also breathing.
Not very accurate. Thank you
Alright.
for trying your best. I will actually explain the sentence because it seems like you guys couldn't really understand it. Because I know it's like it is two sentences, and the second sentence is kind of, you know, prolonged a little bit. But let's hear Jonesy and Behnaz first.
Yeah,
Jonesy, please
it's
go
a
ahead.
bit long. It's long lists we have to
It
make.
is. It's not a list. It's not because of the list. Yeah, it could be, but you know what? I will explain in the end. Jonesy, go ahead.
Okay, thank you. I'm concerned you might have developed asthma. You have wheezing, coughing, and chest tightness becoming severe and constant, with episodes of being too breathless to eat, to sleep, or to eat, to speak, or sleep.
Thank you. Behnaz?
Yeah, I'm concerned you might have developed asthma. You have wheezing, coughing, chest tightness becoming severe and constant with opposite of being too breathy to eat, to speak, or sleep.
Thank you so much. Okay, so can you guys try to explain the sentence? Jonesy, for example, can you try to explain it? What does it mean?
Okay. So the doctor is concerned or worried that the patient might have developed asthma because of the symptoms that the patient is showing, which is wheezing, coughing, chest tightness that is constant and severe. So also the patient, another symptom that the breeze having less breeze and the patient couldn't sleep because of this, couldn't eat and sleep and speak because of the
breathless issues. Great, thank you so much. Amazing. So yes, guys, the sentence again was, I am concerned you might have developed asthma. The doctor is concerned that the patient might have developed asthma, started to have asthma. Because of what? You have wheezing, coughing, and chest tightness. Those three symptoms are becoming severe and constant. Not only this, those symptoms are happening with episodes. Sometimes the patient becomes episodes of what? The patient sometimes becomes too breathless to speak, eat, or sleep. That was the symptom. Okay, it's just a two-line sentence. It could like sound a little bit confusing to you because the doctor just gave the last sentence about the symptoms in just one shot. But I tried to slow down for you guys so you understand, so you can understand the sentence. That's friends. Friends, unfortunately, yes, unfortunately, we still cannot hear you. Try to leave. Let me, okay. I will kick you out from the school and give you a call back. Maybe it works that way. Friends. Okay, until friends join, I'm going to give you the next sentence. We don't have any problems memorizing acronyms or medical terminologies, you mean. What's the problem, Gisner? We're having issues remembering the long interpreting sentences. We need to figure out a way to become more efficient on the note-taking skills. Watch the video that I sent you again. The video that I just mentioned you before the I mentioned you on before the session today. Watch it once and twice until you fully understand how to take proper notes and to keep up with the pace of the speaker. And not only this, you need to practice by yourself at home. You need to just play any English speaking video, any English video on YouTube or whatever. Play the video and start taking notes. Take your notes. Okay? Yeah, I'm sorry, Johnson. Gessner, take notes. Practice at home a lot by yourself because I know this is not gonna happen in one night. Of course, you're not gonna do it the best thing ever from the first time you try or the second time or the third time. You need time to develop those skills because in your real life, in our real life, actually, we're not used to doing that. In our real life, we are just hearing what people are saying. We hear to respond, but we never hear to reply. I'm sorry, we never hear to repeat. We're not used to this. So if this is the first time in your whole life to actually face or do something like this, then you need to practice a lot to be able to catch up with, you know, or to keep up again with the speed or the pace of our sessions. Because maximum we're going to give you 2 weeks of training sessions, and during those 2 weeks you have to work on your skills, and like you have to be, you know, you have to do a comprehensive kind of studying and working on your skills. This is how we all started. This is how we all as interpreters started. Even I had the same thing when I started around 7 years or 8 years ago, when I started to work as an interpreter. The training was only for 2 weeks, again, 2 working weeks, like 5 days without the weekend. And we had to work on ourselves comprehensively. So please do the same. I know you can do it, but this is what I can help you with right now, unfortunately. No one can help you but yourself. With a lot of working, a lot of practicing, a lot of studying, a lot of time that you spend by yourself, doing this and that, trying with videos, reading a lot, reading from other interpreters' experiences, reading about their experiences, watching videos, and all these things will help you to improve yourself in just 2 weeks and pass the internal assessment. But you need time. You just need time. The 2 hours that we spend in the training are not enough. Okay, so let's get back to the sentences. Next sentence. Asthma can also cause breathing faster and a fast heartbeat, drowsiness, confusion, exhaustion, or dizziness. You need to be very careful and make sure you have proper medication. Okay. Noodly, can you please start? Noodly? Noodly is not here, seems like. Okay. Friends, go ahead. Friends? Friends? Okay, it seems like you're maybe having the same problem. I really don't know. I just tried to like um I will try one more time to remove you and add you again. See that works. Oh, Moodly and friends. Okay. Kundan, please start.
Yes. What I noted down was
Kundan, you're breaking up and now we lost you.
hello.
Yes, dear.
Yes. What I noted down is
Is what?
I'm still actually phrasing my sentences. So, it's the first sentence is a bit up. So after that, it's breathing, heartburn, drowsiness, exhaustion, and dizziness. And you need to be careful and have proper medication.
So what was the first sentence? Try to remember. We were speaking about.
I believe you have asthma.
Mm-hmm. You have asthma? No, it wasn't you have asthma. So you said drowsiness, confusion, and what else?
Uh, Drowsiness, exhaustion, dizziness.
Okay. Anything else that you quote?
You need to be careful and have proper medication.
Okay, so you missed the first part of the sentence. Okay, please practice active listening so you can get or catch the sentence from the beginning until the end. Thank you, Kundan, for trying.
I'll do what you just suggested a few minutes back.
Okay, thank you, my dear. Dash?
Okay, so asthma can cause your breathing first go faster and heartbeat faster, and it can lead to exhaustion, dizziness. So you need to be careful and take proper medication.
Thank you for trying your best. You have just one omission and one addition.
All right.
Thank you.
Thank
Stevens.
Yeah, ma'am.
Stevens, go ahead.
Yeah. Asthma can also cause lost breathing and heart beating, exhaustion, dizziness. You need to be careful and take proper medicine.
Thank you so much. I'm sorry, you said what are the symptoms again? I'm sorry.
Exhaustion, dizziness.
Mm-hmm. What else?
Oh, okay. Just let me try it again.
Okay, okay. Please, thank
Okay.
you.
Asthma can also cause loss of breathing and heart beating, exhaustion, dizziness. You need to be careful and take proper medicine.
So you have two omissions, but thank you so much. Um, Dash, by the way, you don't have one addition, you just have one omission. Or you have
All
omissions, but you don't
all
have
right.
addition.
Thank
It
you.
is acceptable, even if you added this word, but it gives the same meaning, which is okay.
Okay.
Peterson?
Yes, ma'am. Can you hear me?
Yep.
Okay. You said asthma can also cause breathing faster and a fast heartbeat, exhaustion, dizziness, fusion, or dizziness. You need to be very careful and make sure you have proper medications.
Thank you so much. Did you say drowsiness?
Yes.
Really?
Is that it? Is that it drowsiness?
Yeah, you said breathing faster, fusion,
Yes.
exhaustion, dizziness, and what else?
Dizziness. Dizziness.
Oh, okay. So dizziness, exhaustion, and what else?
Yes. Drowsiness, fusion.
Mm-hmm.
Okay, you said a fast heartbeat, exhaustion, drowsiness, fusion, or dizziness, isn't it?
Okay. Yeah, that's correct. Thank you so much.
Okay, thank you, ma'am.
Thank you. Do we have Javier or Javier already left? Javier, please go ahead.
Asthma can also cause fast heartbeat, drowsiness, exhaustion. Exhaustion, dizziness, confusion. Yeah. Please make sure please be careful and make sure you take proper medication.
Thank you so much. You have just one omission, but thank you.
Sure.
Do we have Diego? Where is Diego? Diego's here. Okay, Diego, please go ahead.
Yes. So asthma, sorry, asthma can also cause breathing problems, loss of breath, faster heartbeat, drowsiness, dizziness, exhaustion, and confusion. So you have to be careful to have proper medication. I think I added something.
Yeah, breathing problems and what else?
I think I heard loss of breath at the start, but I'm not sure now. Then I said
No,
faster heartbeat, drowsiness, dizziness, exhaustion, and confusion.
it's not loss of breath and it's not breathing faster. It's just one word that you
No,
built on.
I didn't say breathing faster. I said breathing problems, loss of breath, and faster heartbeat before
You know what?
drowsiness in the rest.
It's actually breathing faster. The
Oh,
word
it's
that
breathing
you're,
faster?
yeah, it's
Oh crap.
the word that that you don't want to admit that you said it. It's actually this is the wrong one. I'm sorry. This is the right one. Okay, thank you so much,
So it's
Diego.
breathing
Uh,
faster and also faster heartbeat?
yeah,
Both of those?
breathing
Oh, okay.
faster and a fast heartbeat. This is something and this is something else. This is with the heartbeats and this is with the the breathing.
So there's no loss of breath in there.
Mm-mm, mm-mm. No,
Okay. Okay.
no loss of breath.
Okay, thank you.
Thank you, Diego. We have friends. Friends, can you please try? Friends,
Can you hear me
maybe.
now? Can
Oh,
you hear
yep.
me now?
Yep, I can hear you now. Please go ahead.
I think I've heard that asthma can cause you have hard breathing and like fast heartbeat, fusion, drowsiness, and exhaustion dizziness. And he said
Mhm.
that you need to be very careful and make sure you have proper medication.
Thank you. But what was the first symptom asthma can cause?
Uh, I think I've heard hard breathing, something.
Hard. Okay, okay. So this is the second. What was the first about the breathing? You said
I
hard
have,
breathing?
yeah, and I have fast heartbeat.
Hard breathing, hard breathing,
Yeah,
hard breathing.
yeah. Is it,
If
is it,
you're breathing hard and if you're breathing fast, I guess they are not giving the same meaning, right? Because someone is having a hard breath. Maybe they're breathing hard, like trying as much as they can to catch the breath. Maybe that's breathing hard. But breathing faster is when you
oh,
do that.
okay,
Okay.
okay, I understand. Yeah,
Or it's not faster. It's like faster is like you're breathing fast. Your chest is up and down.
actually, I
This is
thought,
a breathing fast.
so does it mean that is it like when you're breathing fast, I think it's still hard to breathe, right?
Well, okay. So let me try to explain again. Breathing faster is when you are breathing normally, but your chest is moving up and down
Yeah,
in a higher rate than normally. Okay, so this
yes,
is breathing faster. But
yeah,
catching your breath or breathing hard is what I did before. When you're trying to
okay,
catch your breath.
all
Really
right,
gives the same meaning.
got it.
And breathing harder gives them more meaning to words that you are unable to breathe. Breathing harder or trying to catch the breath. Yeah, but I don't think that breathing faster is equals breathing hard. Anyways, okay,
All
we're
right,
trying as much as we
understand.
can to be accurate, but thank you
Yeah,
so much. That was the only
you're welcome.
comment. Thank you, Rolf.
Thank you.
I'm sorry,
Thank you
friends.
very much.
Rolf,
Yeah,
do we have Rolf? Rolf left already. We don't have Rolf. We have Noodly. Noodly, please try. Oh, Rolf is here.
Can you hear? Can you hear me?
Yes, please, dear. Go ahead.
All right. Okay, I'm gonna tell you what I caught. Yes, from those things that you said, I heard um, asthma can also cause breathing faster and fast heartbeat, drowsiness, confusion, exhaustion, dizziness. Uh, you need to be very careful and make sure you have proper medication.
Thank you so much. That's amazing. Noodly, Noodly, Noodly is still not here. Gessner,
Yes, ma'am. Asthma can also cause breathing faster, heartburn, exhaustion, dizziness. You need to be very careful and have the proper medication.
heartburn is not correct because heartburn has nothing to do with asthma. What is a
Okay,
heartburn?
that's when you have acid.
Exactly. So it has nothing to do with asthma. Asthma happens in the chest, in your lungs.
Right.
And you have two omissions. But thank you for trying your best. Um, don't say.
Okay, thank you. Asthma can also cause breathing faster and a fast heartbeat, drowsiness, confusion, exhaustion, or dizziness. You need to be very careful and make sure you have proper medication.
Thank you, dear. Behnaz?
Yeah, asthma also causes breathing fast and a fast heart rate, drowsiness, confusion, exhaustion, dizziness. You need to be very careful and make sure you have proper medication.
Thank you, dear. Next sentence. Do I need to like explain this sentence, or I guess it's already like it's understood, right? Okay. Next sentence. Next sentence. We're talking about symptoms a lot. Okay. So next sentence. We need to check your thyroid with the symptoms you have of tiredness, weight gain, constipation, depression, slow movements and thoughts. We might have to medicate you. Um, Dash?
Okay. All right. We need to check your thyroid because of the symptoms that you show that includes tiredness, constipation, depression, slow movement, and thoughts. We have to medicate you.
Thank you. You have one omission and one inaccuracy. I'll let
Yeah.
you know in the end.
All right.
Stevens. Steven. Stevens, can you hear me? Peterson. Peterson, please go ahead.
Hey, ma'am, can you hear me?
Please go ahead. Yep, I do. Peterson, you're muted.
Okay, ma'am. You hear me now?
Yes, I can.
Okay, I'm sorry. I think that I missed one word. I think you said, we need to check your thyroid. We with the symptoms you have of tiredness, breathing, constipation, depression, slow movements. Sometimes we might have to medicate you.
Thank you. You have one omission.
Oh, I'm sorry, ma'am.
No problem. Thank you.
Okay.
Friends,
I'm here.
thank you.
Hello.
Yep,
All right.
thank you. Please go ahead.
Cool. What I heard is we need to check your thyroid because of the symptoms that you've shown in tiredness, constipation, depression, and I think, and we might have to medicate you. That's all
Thank
I
you. Yeah, you have three omissions.
I
Uh, Thank you, my dear. Well, well, okay, Gisner.
Yes, we need to check your thyroid with the symptoms you have from, I didn't catch it, from tiredness. We might have to medicate you.
Wow, you just missed all the other symptoms? Just tiredness?
Tiredness. tiredness. That's what I
Yeah.
caught on my notes. I'm gonna try not. Yeah.
Okay. Okay. Thank you for trying your best. Kundan.
Yes, ma'am. We need to check your thyroid because of the symptoms you have: tiredness, weight gain, constipation, depression, slow movements. So we might have to medicate you.
Thank you so much, except that you have just one omission. Javier.
We would need to check on your thyroid with the symptom of tiredness, constipation, depression, slow movement, and you might have to, we might have to medicate you.
Thank you. You have just one omission, but thank you. Diego.
Yes. We need to check your thyroids with the symptoms you're having of tiredness, wheezing, I think, constipation, slow movements, and thoughts. We may have to medicate you.
Thank you so much. You have one misinterpretation and one omission.
Okay, thanks.
Thank you. Stevens and Noodley. Can you hear me?
Yeah, ma'am. Can you hear me?
Please go ahead.
Okay. We need to check your thyroid with the symptoms you have shown: tiredness, constipation, depression, slow movement. We might have medicate you.
You guys, you like none of you got this one symptom that I don't know why you're all omitting this one symptom. Thank you so much. You have one omission.
Thank you.
June Say and Behnaz.
Should I go first?
Just anyone. No
Okay.
problem. Who's this?
Behnas.
Behnaz, please go ahead.
Yeah. We need to check your thyroid with symptoms of your tiredness, weight gain, constipation, depression, slow movement, and some thoughts. We might need you to medicate you.
We might need to medicate you. Okay, thank you. June Say.
Okay, thank you. We need to check your thyroid with the symptoms you have of thyroid, weight gain, constipation, depression, slow movement, and thoughts. We might have to medicate you.
Thank you so much. Noodly and Roll. Roll, can you hear me? Noodly and Roll.
You hear me?
Please go ahead.
You hear me? Noodly.
Yes, please go ahead, my dear.
Okay, you need to check your thyroid with your symptom, breathing, the constipation, the depression, and slow movement. You have to medicate you
We need to check your thyroid and what else?
with your symptoms, with
Mhm.
your symptom, breathing, the constipation, depression, slow movement. You may have medicate you.
The first symptom is breathing. Did I hear you correctly? You said breathing, deconstipation, and depression, right?
Yes, slow movement.
Slow movements, okay. That's okay, and depression is okay. But the
You have
first two are not okay. Actually, it's constipation, it's not deconstipation.
okay.
So constipation is okay. Depression and slow movements. What else?
You may have medicate you.
We may have to medicate you. Okay, thank you. You have omissions, but thank you for trying.
Okay.
Well, can you hear me? Well,
Yes, can you hear me?
yes, dear. Please go ahead.
Um, yes, we need to check your tired rate. The symptom you have: tiredness, um, gang rate, constipation, depression, slow movement, and we may have to medicate you.
Thank you. But what is the first symptom that you said?
Tiredness,
Tiredness, and then what else? Tiredness, and what else?
weight weight gain,
Okay, weight gain.
constipation, depression, slow movement.
Okay, amazing. You just have one omission, but thank you so much.
Wonderful.
Okay, guys, let's take a quick 10 minutes break and come back. Okay, let's just refresh our minds and just do some, you know, uh, what
May you
exercises maybe,
may
just
you
to
repeat
move our
the
legs.
sentence?
To do what?
Repeat the sentence.
I mean, you said, yeah, maybe
You
we
you
take
want a
time
repetition for the
from yoga.
sentence?
Yeah.
Okay, sure. So the sentence again was we need to check your thyroid with the symptoms you have of tiredness, weight gain, constipation, depression, slow movements, and thoughts. So you're having slow movements and thoughts. We might have to medicate you. That was the sentence.
So I only didn't like weight loss, but everything was on point.
Dash, yes, you just have one omission, but everything
Yeah,
was
yeah.
okay.
All right, thank you.
Okay, guys, so 10 minutes and come back, okay?
Okay, ma'am.
Okay, ma'am.
Okay.
I'm back. Are you back?
Yes, ma'am, we back. I'm back too. I don't know others.
Amazing. Thank
Yes,
you.
ma'am.
Okay.
I'm here.
Thank you. Who else? Who else? Who else is here? I'm going to like change the sentences that we're using, and now I'm going to use with you guys the real scenarios. We have real scenarios from real calls, and what we just changed it, like we just changed the names. 5 more minutes, and we're actually going to end the session. So let's just give you like 2 more sentences or 3 sentences and end the session, okay? And you can do whatever. So I'm going to use the scenarios that we have from real calls, except that we changed the names of people, of course, for confidentiality. So you will get a better idea of how, you know, real calls would go. Okay, so I hope that you're all here. I will just start in 1 minute. 15 at sharp. I'm sorry, 50 at sharp. Okay, 1 more minute. Let me give you a brief introduction about this tool that I'm going to use here. A patient is doing physical assessment, and the nurse is questioning Mrs. Davis about the probable cause of the injury. She's having an X-ray. She did an X-ray on the place where she has the pain. She's having a swollen left thumb and hand. So her left thumb and hand are swollen, and they are like this place is very painful. So she did an X-ray, and she's having this conversation with the patient. First sentence is from the nurse. So the nurse here said, please be ready, guys. Mrs. Davis, as the doctor told you, your thumb is not broken. It is injured. It's going to require a splint to immobilize it. Do you know what happened to it? Have you injured it? Um, Gessner, please start. Gessner?
Mr. Davis, um, I guess you have a broken thumb. The doctor will apply a splint to immobilize it. Did you know what happened to it?
This is not very accurate. Kundan.
Yes, ma'am. Mrs. Davis, as the doctor told, your thumb is not broken, it's injured. And then I didn't get the second sentence. The last one is, do you know what happened to it? Have you injured it?
Thank you. But the omission that you had is very important. This is actually giving more information to the patient what they're going to do next. Stevens. 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 Peterson. Peterson. Do we have Peterson? Oh, Peterson.
Yes,
Please.
yes, ma'am. Can you hear me?
Yep, sure. Please go ahead.
I think that I still miss one word. Okay, you said Miss Davies. As the doctor told you, your home is not broken, it's injured. It's going to require, I didn't know, I didn't hear this word, to immobilize it. Do you know what happened to it?
Okay. But where the problem is again, I'm sorry?
Your
Where
home. I think
it
that the home of Miss Davies,
it's
it's
the
not, it's
thumb,
just, it's palm,
the thumb,
thumb.
the
Oh, okay.
big.
Yes, yes, yeah. I'm sorry, ma'am.
Okay. Thank you. Javier.
Mr. Davis, doctor told you that your thumb is not broken. The doctor will help you immobilize it. Do you know what happened and did you injure it?
You're as the doctor said that it's not broken, and you have
Yeah.
one omission. It's going to require what, or what the doctor is going to do?
The doctor will immobilize it.
The doctor will immobilize it? No, it's not. It's not something that a doctor would do. Okay, so unfortunately, this is not accurate.
I missed the second part. Yeah.
Yep. Okay. Rolf? Do we have Rolf? Rolf is here. Rolf, please go ahead. Rolf, Noodly, and friends. Those who are having problems with their connection. Rolf, Noodly, and friends. Can you hear me? Rolf, Noodly, and friends.
Yes. Could you
Yeah, I
please
can hear you.
say the sentence again because I haven't kept the first part of the sentence.
Okay, so Rolf didn't catch the sentence. What about friends?
I
Friends? You're muted.
I got part of it.
Okay, just go ahead.
I Miss Davis, as the doctor said, your thumb is not broken. I think it's like no, not what the doctor said. It's injured and it's going to require sometimes to stabilize it. Do you know what happened to it?
Yeah.
That's
Okay, so
what. Mhm.
mm, the middle sentence is not correct, unfortunately.
All
So
right.
thank you for trying your best.
I thank you. You're welcome.
Stevens was eating. Okay. Stevens didn't catch the sentence. Noodly, please go ahead.
Excuse me, sir. I didn't catch you well because the connection was bad for me.
Okay, no problem. You can mute yourself.
Yeah.
Diego, please go ahead. Diego. Diego.
Yes, yes, Norhan. I am here. I am here.
Yep.
Sorry. I'm
Okay.
here. So the sentence was, Mrs. Davis, as the doctor said, your thumb is not working, but it is injured. You will need to get. I thought I had spleen, but I thought that was something else. And the last phrase was, do you know what happened to your thumb? But yeah, I thought spleen was no. Spleen is
It
something
is a
else.
splint.
Longing. A
It
what?
is a splint.
Splend.
Yep.
Oh, okay. So I was I was close, I guess.
Yep.
Splend.
Okay.
Splend.
Well, yeah, unfortunately, your sentence is not very accurate. Who else? Dash.
Yeah, can you hear me?
Yes, dear. Please go ahead.
Mrs. Davis, the doctor told me your thumb is not broken, is injured. You will need a splint to mobilize it. Do you know what happened? Or did you hurt it?
Did you hurt it?
Did you hurt it? Yeah, that's
Okay,
what I
okay,
wrote.
okay. So
Hey, have you hurt it?
okay, acceptable. Except that the splint is to do what to the thumb?
Uh, to mobilize.
No, actually, it's the opposite. It is to immobilize.
Immobilize, okay. Immobilize. Yeah.
No, Diego, it's a splint. SPLINT.
NT, yeah.
Exactly. This is a splint. Jonesy, I'm sorry, Jonesy and Behnaz.
Yeah, should I go first?
Sure, go ahead.
Yeah, Mrs. Davis, as the doctor told you that your thumb is not broken, it is injured. It is going to require some plant to immobilize. Do you know what happened to it, or have you injured?
Thank you, Jonesy.
Okay, thank you. Mrs. Davis, as the doctor told you, your thumb is not injured. Is not broken. It is injured. It is going to require splint to immobilize it. Do you know what happened to it? Have you injured it?
Thank you so much. The next sentence in this conversation. The patient, of course, she replied, this is for you guys. I'm just telling you what's happening or what they are saying so that you can follow on the conversation or follow the conversation, follow what they're saying. So the patient said that she cannot remember. All she can remember is that she was driving and she was feeling uncomfortable with the seat belt on. So she wanted to keep it buckled. It's very important to wear a seat belt. So it was bothering me on the left side of my belly. I hooked my thumb inside the seat belt so so I can keep the edge of it away from my skin. She tried to explain how she thinks the injury happened. Okay. Then the nurse said, this is the sentence that you guys are going to take a note of. Um, well, there are a couple of things that might have happened in the force of the accident. That thumb might have remained hooked in the belt. It would have been pushed and pulled with a great deal of force when you were hit and then again as you come to a stop.
I'm sorry, ma'am. I missed all that part.
Who's this?
It's Peterson.
Peterson. Why?
I'm sorry. I didn't I would say that I didn't know that you were about to give the last phrase. Sorry,
Right.
the last
Well,
sentence. The last
I
sentence.
clearly said that this is going to be the sentence that you guys are going to take notes of, right? So
Yes,
did you
I'm
pay
sorry.
attention?
No,
You
I
didn't.
wasn't.
Okay, thank you. Who's confident about this sentence? Let me just do it that way. Who thinks that they got the full sentence and they can give a rendition? No one? Behnaz?
Yep, miss.
Yep. Would you like to try?
Actually, that was really long, but I want to give it a try. The patient said all she can remember is that while she was driving, feeling uncomfortable, sitting belt on the keep bucking, and actually, that keeping the seat belt is really important. And actually, I missed all
Well, that okay, dear. That was the part that I was giving to you because I said that I'm going to use real scenarios, real conversations.
Yeah.
Okay, so I was just explaining to you what the patient said, because the part that I'm going to use is the part of the client.
That's okay. At first, it was really long, but translating to my language is going to be really easy. But telling exactly the same words as English, that's a little bit difficult.
Okay. Again, you just didn't
But give
understand
me
the
time, I
sentence.
will organize my notes.
The sentence of the nurse that I gave you in the end was the only sentence that you should take your notes about or for, which is, well, there are a couple of things that might have happened in the course of the accident. That thumb might have remained hooked in the belt. It would have been pushed and pulled with a great deal of force when you were hit, and then again as you come to a stop. So the nurse here is trying to explain to the patient how the injury might have happened. And this is a real cool. So if you were in this school, you were actually supposed to understand this and translate this and take notes of it and translate it. Okay, let me change this conversation because it seems like maybe this is like an advanced level or something. I'll give you another one that could be a little bit easier. Okay. Another one here. Guys, are you ready? Please don't tell me that you weren't paying
Yes,
attention
ma'am.
or that you weren't ready. Okay? Okay, very well. Sentence says, Sir, you are in the ER of Okla Trauma Center. You have been in a motor vehicle accident and we are taking care of you. You were incontinent of urine on your way here, so we have put in a catheter to help you with that for the time being. Who wants to start? I guess this is a little bit easier than the last conversation, right? Who's confident about it? Who wants to start? Can raise your hand. Come on. Guys, who did catch the sentence? Oh no. Oh no.
Okay, if you let us, we will organize it. Behnas.
To organize what? To organize your
Or
thoughts?
note. Yeah, just
The order?
our
Oh, it's
note.
fine. Well, I can just call whoever name and they're going to start as I do, but I just want to see who got the sentence and who's confident about it. Who got it from the first time? Because this is a real conversation, guys. This is a real call. Which means that if you were in this school, you were actually supposed to get it, or you could have like got it from the first time. Don't say. Would you like to try?
Okay. Sir, you are in the ER of the trauma center. You have been in the motor cycle accident. We are taking care of you. You were incontinent on your way here. You are put on catheter. And I didn't cut the last.
Okay. But what the nurse is saying is actually coherent and it makes sense that we are having a patient in the ER. What is ER?
Emergency
room.
Emergency room, exactly. So someone is actually they got that patient to the emergency room and the patient was in a motor vehicle accident and they're taking care of the patient and the patient has just woke up from the whatever the coma or maybe he was in conscience. So it makes sense, right? If you visualize the situation, you will be able to understand the speech better. Not only focusing on your note taking, but you're also following the speaker. You understand what they're speaking about. You are visualizing the situation. You're trying to imagine what's the situation there in the emergency room. Okay.
Yeah.
Thank you, Jonesy, for trying. Dash, would you like to try? Would you like to?
Uh, Actually, I was gonna add that yeah, we understand. I'm understanding the message, but yeah, to render the exact sentence, it's hard. The exact. Let me go ahead.
I don't
Uh,
want you to give me the exact sentence, but I want you to be accurate at least.
all right.
Accuracy. Don't omit any information. Don't add any information. Don't misinterpret or change a meaning of a sentence. Just give me the sentence, not exactly sticking to the words that the person used, but rather give me the sentence as it is, as much as you can. Even if you change some words, that's fine, as long as you didn't change the meaning.
All right. So we are at the ER of Okran Trauma Center, and you were in the middle of a motor vehicle accident. There a content of urine, uh, but we used a catheter to help you. Yeah, with that, in case you want to
Amazing.
relate. Yeah.
Thank you. Amazing. Thank you so much. This is all of it. You actually got it all.
All right.
Thank you, Dash. Who else wants to try it? It's easy, guys. If you visualize the situation, you will be able to get the sentence.
Can I?
Sure, go ahead.
Yeah. Sir, you are in ER clutch room. So you have been in a motor vehicle accident, and now we are taking care of you. So you were incontinent urine on your way here. We have put in the catheter, and now we help you for the time being.
Amazing. Thank you. Diego.
Yes, sir, you are in the ER of the Oakland Trauma Center. You have been in a motor vehicle accident. We are taking care of you. You are incontinent on your way here, so we have put in a catheter to help you with that.
Amazing. Thank you. Guys, now you're getting it. Let me give you another sentence. Okay?
Let me try.
Sure, go ahead.
I don't think I get it right, but let me try.
Okay.
Sir, you're in an ER of a cloud trauma center. You've been in a motor vehicle accident, and we are taking care of you. You're incontinent on your way here, so we've put in and consider to help you with that for the time being.
Mhm. Amazing. Thank you. Guys, it is very easy. So you will get it better with real conversations than with the sentences that we were actually giving you with the lists of symptoms and all this and that. I will give you one more sentence, last sentence, and let you go in peace, okay? Because I know we stayed for more than 2 hours. Um, okay. Okay. Uh, Mrs. Davis, you are in Fady General Hospital. It's 2021. You have been in a car accident and we are taking care of you now. I am your nurse, Caroline. Come with me, Mrs. Davis. Let's get you back in bed for a bit. You seem a bit confused and I want to help you with that. Okay. Gessner, can you please try?
Yes, I think you said, Mrs. Davis, you have been in a car accident, and I'm the nurse, um, and I'm gonna take care of you. Come with me.
Thank you for trying your best, but this is This is okay, but you're having a lot of omissions. One of the most important piece of information is names. If you remember in the protocol, I'm not sure if you were there, but if you watched the recording when I was explaining about the protocol, I'm sorry, when I was at, oh no, I didn't say that in the protocol. I said that when I was talking about the note taking. The keywords, guys, one of the keywords that we have to take down in our notes as soon as we hear it, names. Names and numbers. Those are keywords. So here in this sentence, I use two names, or actually three names. The name of the patient, the name of the hospital, and the name of the nurse. And a number. The number of the year, what year that was, or what year this is. Because here the patient seemed to be confused. So the nurse is actually trying to, get her back to reality. That this is the hospital and it's 2021. You were in an accident and we're taking care of you. I am a nurse, or I am the nurse, and my name is 123, blah blah blah, and so on and so forth. Okay. Thank you, Gessner. Peterson, would you like to try? Peterson.
Yes, ma'am. Can you hear me?
Yes, please. Go ahead.
I'm sorry, I missed some word, but I don't think that it was like some keywords. Okay, Mrs. Davis, you're in a hospital. It's 2021. You've been in a car accident, and we are taking care of you now. I'm your nurse. Come with me, Mrs. Davis. You seem a bit confused, and I want to help you with that.
Thank you so much, except that you omitted the name of the hospital and the
Yes,
name of the nurse.
yes.
Guys, names, okay, names are very, very important. Why? Because when the client gives a name, either their name or a name of something, a name of a place, or a name of a medication, or names, because names, again, cannot be translated. Names are names, okay? Like your name, we can't translate your name. So names are names in all languages. If I say the name of the hospital is this and that, you have to say the name of the hospital as it is in the other language. So names, when the client gives names, they are waiting to hear that name back in your rendition from you. They are waiting to hear the name again. So if they don't hear the name, they would think, oh, interpreter is actually omitting information. Interpreter is not transparent. Interpreter is not doing their job. They might be saying something else. And now they're going to question your interpretation. If they don't hear the same information that they expect to hear in your rendition, they are going to question your interpretation. The interpreter is not doing their job. Where is the name of the hospital? Where is my name? Caroline. Caroline is Caroline in all languages. Faith General Hospital. This is the name of the hospital. And by the way, any names that they are using in their own country, whatever that name is, you have to say the name as it is, even if there is like a translation
You
first, even if there
know,
is a meaning to that in your language, you have to say it in English as it is, because those are names. Number one. Number two, the LEP, or the patient, or whoever, the other person has to know the names of things and names of people as they are in the country where they live, because they live in an English speaking community, so they have to know the names of people and the names of places the same way they hear it there. Okay? Yes, Peterson, do you have a question?
yes, ma'am. It's not really a question. I think that what makes the word I think like what makes some names difficult is because like there are some names that we are not used to hear. I don't know if you see what I'm saying. Like if you're not used to hear this name, it can like give you some problems to see.
Okay. But again,
It's
names
really
are names. Names are names. Names of places, names of medications, names of people. Names are names. You cannot translate names. Okay? And the patient, the LEP that you will be having in the school, is someone who actually lives in this country where they are using this name of a place or a medication or whatever. So some of the Spanish interpreters that I monitored their calls, they used to say the name of the medication in Spanish, which is incorrect. The name of the medication has to be said as it is in English, because this is how they're going to ask for that medication in this country. This is how they're going to speak about this medication in this country. Okay, so names are names. Even if you have a name for it in your language, use the English name. Okay, let me leave you guys today at this point. Thank you so much for attending the session until the end. I'm not sure if I'm going to actually meet you tomorrow again. Tomorrow you will be sent to different groups with different timings, I guess. You're not gonna be attending at 12 p.m. All of you at 12 p.m. EST. You will have your sessions with Zainab. She will focus more on, on your performance, on giving a score or not a score. Like, he's going to focus more on the feedback about each and every one, about your performance, about the performance of each and every one. So starting tomorrow, please make sure that you are that you studied the medical terms and acronyms. I didn't really ask you about the protocol today, which I should have done, but she's going to make sure again that all of you are studying, all of you are performing well. Starting tomorrow, please do everything as it should, as much as you can. Again, I don't want to pressure you, but I wish you all best of luck in the coming sessions with Zainab, and do your best, please. Thank you, all of you. See you next time. I don't know when, but see you next time when you are in good health, in good shape, in good mood, and everything. Thank you. Best of luck.
Can I
I'm sorry, someone wants to say something.
Yeah, actually, that was such a pleasure being with you. We learned really things with you. We really miss you.
Oh, thank you so much. Yeah, it is actually a pleasure to meet you all, and it was a pleasure having the first three sessions with you all. You are one of the lovely groups that I had. So I really wish you all best of luck. Thank you, and study well, please. Bye bye.
Thank you. Thank you.
Thank you. God bless you.
Thank you, ma'am.
Okay, Laura, thank you.